Hello, and welcome to the Kansas State Veterinary Diagnostic Laboratory YouTube channel. This video demonstrates serum sample collection. Serum samples are one of the most commonly required samples for diagnostic testing. The collection and handling of these samples will affect the quality of results achieved. Serum for diagnostic testing should be non-hemolyzed and not lipemic. Depending on the test requested, hemolysis and/or lipemia can render the sample unsuitable for testing. Since unsuitable samples are a waste of time and money, lipemia should be avoided. When possible, the patient should be fasted overnight or for 12 hours prior to sampling. Red blood cells hemolyze when forced through a small opening or subjected to turbulent flow. It is important to select a vein and needle of adequate size and avoid sludging as the sample is collected. The handling of the sample after collection is equally crucial. Introduce the blood gently into either a red top tube or a serum separator tube. Allow the vacuum within the tube to draw the sample until it stops flowing. Forcing the sample into the tube creates additional hemolysis. If a needle smaller than 22 gauge was used to collect the blood sample, remove the needle from the syringe and the cap from the tube, then introduce the sample into the tube and replace the cap. Allow the blood to clot. The tube should be upright while the blood is clotting. Serum separator tubes contain no anticoagulant, but do have a clot activator. They generally yield more serum than red top tubes. The clot activator can be enhanced by inverting the tube gently several times before allowing the blood to clot. Blood in a serum separator tube should be allowed to clot for 15 minutes. If the blood is collected in a red top tube, the tube need not be inverted. Blood in a red top tube should be allowed to clot for 30 minutes. After the clot is formed, centrifuge the sample to separate the clot from the serum. This will allow you to assess the degree of hemolysis. Excellent serum samples will not have hemolysis. If you've used a red top tube, pouring the serum into a clean tube will prevent hemolysis when the sample is in transit. Don't forget to label your sample with the patient's name, the doctor's name, and the date of collection. Serum samples should be packaged to prevent multiple tubes from banging together. Tube mailers are ideal for this purpose. Other packaging may be used with adequate padding to ensure the tubes arrive intact. Serum samples should be packed on ice packs. A submission form should also be completed. Thank you for tuning into the Kansas State Veterinary Diagnostic Laboratory YouTube channel. If you have questions about this video or any of our services, please visit us at www.ksvdl.org.